So I'll move to introducing the next speaker. And as Stephen alluded to, Tamara Strauss is a patient. She'll tell you her story. I had the pleasure of meeting Tamara about 4 years ago, 5 years ago. Met her parents first, and she'll tell you that story. And she's been through this with us almost from the beginning, through the good times and the bad, and now hopefully many more good times to come. So Tamara, as you're working your microphone, I'll invite you up here. Push B. Cool. You're up. Thanks, Tamara.
I'm the living human that he referred to. My name is Tamara Strauss, and I'm honored to be patient one in the personalized cancer vaccine trial that originally started October 4th, 2018. This trial is truly a novel approach to treating cancer that could change the paradigm of cancer care. It is a way of treating a patient with their own immune system. It is a way of treating a patient with their own personalized cancer vaccine that targets their specific mutations. This is a form of treatment that looks at how the immune system is or isn't working and how it can be jump-started to do what it originally was intended to do. It is a treatment that looks at healing as a cure from within, as Dr. Schoenberger likes to refer to. Is this buzzing? Okay. Okay. But before I get into my patient experience, there are a few things you need to know about me to truly get a picture of my cancer journey the past 4.5 years. First, I'm not a doctor or a scientist, so I bring absolutely no medical training whatsoever to this topic of cancer. I am an artist, more specifically a graduate gemologist and jewelry designer. I'm a Reiki practitioner. Some of you will know it as healing touch. I'm a firm believer in the mind-body-spirit connection. Energy work, prayer, meditation, gem therapy, aromatherapy, pet therapy, and other holistic approaches have played a key role in my healing journey. I believe that we live in remarkable times, as traditional allopathic medicine and holistic medicine are now working hand in hand to bring about even greater healing for the patient. I was a volunteer Reiki practitioner for 5.5 years at San Diego Hospice. When they closed, I became one of the first 2 Reiki volunteers here at UCSD in the Integrative Medicine program. I volunteered for a year in the infusion center here at the Moores Cancer Center. Little did I know that soon I was going to be going firsthand through the experience as a patient. Almost 5 years ago, I was diagnosed with stage 3 pancreatic neuroendocrine cancer. I showed my internist a small golf ball-sized tumor above my belly button. This was on a Friday. The following Monday, I had my appointment with interventional radiology, and by Wednesday, I had a PICC line and was starting chemo. In the following 4 years, I would have 3 major abdominal surgeries, more rounds of chemo than I like to remember, and other assorted treatments. Pretty much your typical cancer journey. A journey one never thinks that they will experience, and one that shakes you to your very core. From the beginning, I've been blessed with loving parents that helped be my navigators. I am also blessed that I had the best of care here at UCSD. I would not be standing here today if it were not for the incredible doctors, scientists, nurses, surgeons, and administrative staff here at UCSD. You all make such a difference in the lives of your patients. I am by nature a positive person. When I was diagnosed, I really got a chance to put this attitude to the test. I knew from the beginning that my attitude toward my cancer and the chemo would play an important part in my healing. I looked at chemo as my friend. It was going to kill the cancer. A dear friend of mine is also a Reiki practitioner here at the Moores Cancer Center. We did Reiki on every bag of chemo before it was administered to me. Intention is a very powerful tool. I always visualized that the chemo would kill the cancer and do as minimal damage elsewhere in my body. I also took a novel approach to loving my cancer rather than being angry. I realized early on that the cancer was a part of me, that I had some accountability for inviting it into my life. I know that many of you will not share the same view. But for me, and for my healing to be complete, I knew that I needed to look at my physical, emotional, and spiritual bodies. For me, cancer has been a master teacher. Cancer has taught me to set boundaries in my life that I was not able to do before. There have been many hidden gifts in this most difficult journey, but I can honestly say I'm happier now than I've ever been in my entire life. Being part of this trial is also a gift. I am very lucky to have parents that could make this trial possible and offer me the opportunity to be patient one. This is an opportunity that I do not take lightly. As much as I want to be healed more than anything, I pray that this truly does change the paradigm of cancer care. I am the only patient to have been treated with both versions of the vaccine. I know that how this personalized cancer vaccine looks now and how it will look when it's better understood will be different. But we have to start somewhere. And I'm honored to be the lab rat for this trial. The traditional chemo and radiation therapies are so barbaric, not just for the patient, but for the family and friends that are involved as well. I was looking at a life of trying to stay ahead of the cancer with treatments. It wasn't a pretty picture for me, but I'm young, I have children, and I have a tremendous will to live. That works for a few years. And then you start to get tired. Tired of treatments, tired of feeling sick, tired of hurting everywhere, tired of not having a quality of life. This is such a dark time for a cancer patient, one where you have to dig really deep to stay hopeful. This is where I was at 3 years ago when Dr. Ezra Cohen suggested to my parents about this new personalized cancer trial that UCSD was trying to get started. I didn't have a lot of options at this time, and this trial gave me hope. Hope that maybe, just maybe, it was time for there to be a shift in how cancer treatment can change. That the patient could be a co-creator in restoring the body to health. That I didn't have to lose my hair, my appetite, my strength to be healthy again, but rather an opportunity to be part of something bigger than myself. An opportunity to help the scientists and doctors discover the cure from within. The best example that I can give you of how unique an experience this is for the patient is from my own personal experience. While I remained hopeful with chemo, I knew that there was going to be collateral damage to my body, mind, and spirit. But with the vaccine, there's only been hope. The first 36 hours after being given the vaccine, I get a fever, chills, aches, and pains. It's hard to describe how I can be so miserable and yet so hopeful at the same time. I look forward to each and every symptom I get. 2 hours after the vaccine is given to me, I begin to get a headache. Chills set in shortly, and then the muscle aches. And as every symptom sets in, There is a mindfulness that my cells are going to war to fight for my survival. There is a joy I feel that has eluded me for quite some time, a hope that this treatment offers me that is hard to describe. I can share with you that it is not just me that feels this way. I am friends with the other patient on this newest arm of the vaccine trial. He feels the same. We both agree that 2 days of feeling like this is way better than the constant and sometimes permanent damage done by chemo and radiation. For me, my quality of life has greatly improved. The vaccines are given 3 weeks apart, along with Keytruda. And while the first week is not a walk in the park, and there are annoying side effects from Keytruda, it beats chemo anytime. My most recent CT scan, as of a few weeks ago, shows me to be a responder. After only 9 weeks of the newest vaccine protocol, my tumors are shrinking and dying. And Dr. Miller is going to give more information later, but as of yesterday, the preliminary biopsy reports came in, and one of my largest tumor, the tissue shows no sign of cancer. This is the first break I've had in 5 years of constant treatment. To say I'm elated is an understatement. I hope that my sharing my story with you helps us all to acknowledge that we are on a new horizon. Thank you.